Before starting with the tongue, I have given the brief introduction of oral cavity, if you remember. Right, then we have discussed the parts of the oral cavity. Okay, then the boundaries of the oral cavity. In oral cavity, how many parts are there? Two parts are there, oral cavity proper and the vestibule. Okay, so what are the boundaries of the oral cavity proper? Then what are the communications of the oral cavity? Next, what are the boundaries of the vestibule? All those things we have discussed, and what exactly is present in the vestibule. Okay, followed by the gross structure of tongue. Okay, now in the gross anatomy of tongue, starting from the parts of the tongue, external features, okay, surfaces, what is present in the dorsum of the tongue, what is present in the inferior surface of the tongue, okay, then blood supply of the tongue, nerve supply of the tongue, all those things are discussed. Okay, the only thing which was left, that is the lymphatic drainage of the tongue. Okay, now in the last class, if you remember, I have mentioned that nerve supply of the tongue is very important. Okay, so whenever I am telling all those things, please note it down. Important means you can expect questions in the exam. That's why I am mentioning. Okay, so note it down. In tongue, nerve supply is very important, because I have shown you, if you remember, this diagram. Okay, and I have written the points also, how to segregate the nerve supply. Okay, in case of nerve supply of the tongue, directly you can't write that tongue is supplied by this nerve. You have to segregate things. For example, motor supply is there. That means the nerve which is supplying the muscles of the tongue. Okay. After that, we have discussed about the sympathetic nerve supply, then sensory nerve supply. Okay, and in sensory nerve supply, two different types of sensations are there: general sensation and a special sensation, that is the taste sensation. So these are the important points which you have to mention whenever you are writing about the nerve supply of tongue. Okay. So next is the lymphatic drainage of the tongue. Now lymphatic drainage of the tongue is also equally important. Okay, why it is important? We'll come to know because of the bilateral drainage from a posterior one third of the tongue. Okay. Now if you see the lymphatic drainage, there are four sets of lymphatic vessels draining the tongue. Okay, what are they? These are apical, marginal, central and basal. Apical, central, marginal and basal. These are the four sets of vessels draining the lymphatics from the tongue. Okay. Now what is the meaning of apical? That means it will be draining the lymph from the tip of the tongue as well as from the inferior surface of the tongue. Okay. So let me show you the diagram. I hope you can see the diagram. Now in this diagram you can see, so these are the apical vessels. So apical vessels will drain the tip of the tongue. Along with that, it also drains the inferior surface of the tongue. Okay. Next, and after draining, where they will go, the lymph will go to the submental lymph nodes. From submental lymph nodes, it will go to the submandibular lymph nodes. Okay, as you can see in the diagram. Okay, so see, these are the submental lymph nodes, and after that, you can see these are the submandibular lymph nodes. Okay, so these are the apical vessels. Next are the marginal vessels. So marginal vessels will drain the lymph from the margins of the anterior two-third of the tongue. You see, you have to be very specific whenever you are writing about the lymphatic drainage. Okay, so the marginal vessels, okay, they will drain the margins of the anterior two-third of the tongue. That also unilateral, and then ultimately they will go into which particular part? As you can see, first from submandibular lymph nodes, they are going into jugulo-omohyoid lymph nodes. Okay, which is present along the inferior jugular, internal jugular vein. Okay, along with the internal jugular vein. Okay, so that is the marginal vessels. Next is the central vessel, where you can see these are the central vessels. Now central vessels will drain the central portion of the anterior two-third of the tongue. Okay, now they will pass vertically downwards. Okay, and from there, where it goes bilaterally to the deep cervical lymph nodes. Now this is the most important case. till now we have seen that the apical and the marginal, okay, they are draining unilaterally. मतलब right side का right side में जाएगा, left side का left side में जाएगा, okay, the drainage. But in case of central vessels, what they do, they will drain the central part of the anterior two-third of the tongue, okay, and then where they will go to the deep cervical lymph nodes on both the side. As you can see in the diagram, these are the central vessels, okay, draining the central part of the anterior two-third of the tongue, and then they will go into the deep cervical lymph nodes of both the side. So that is called bilateral drainage, okay. Next, after that, basal vessels are there. So what about the basal vessels? As you can see, the basal vessels mainly they are draining the root of the tongue and posterior one-third of the tongue. Okay, root and posterior one-third of the tongue, that is drained by basal vessels. Okay, they also drain bilaterally. Okay, that means on both the side. Ultimately, where they will go deep cervical lymph node, including jugulodigastric lymph nodes. As you can see, jugulodigastric lymph nodes and deep cervical lymph nodes. Okay, so this is the complete lymphatic drainage of the tongue. Now there are some peculiarities of the lymphatic drainage of the tongue. Okay, what are those peculiarities? Okay, as you can see, lymphatics do not accompany the blood vessels over here in case of tongue. This is one important peculiarity. Then in the midline, a free decussation takes place of the lymphatics which pass bilaterally. Okay, that is the decussation of the lymphatics taking place, especially in the midline. Next, the tip of the tongue is having richest lymphatic drainage. Okay, so a cancer affecting the tip, okay, can spread to the different areas by cervical lymph nodes. Okay. Next, a group of lymph nodes situated at the bifurcation of the common carotid artery, okay, is draining most of the part of the tongue, and that is nothing but the deep cervical lymph nodes. Okay. So that is all about the lymphatic drainage of the tongue. Now, with the lymphatic drainage of the tongue, the gross part is over. Okay. Next, we will see the applied importance of the tongue. Okay. Now, anyone, do you remember the blood supply of the tongue which we have discussed in the last class? I have explained about the blood supply of the tongue. From different sources the blood supply is coming, and I have mentioned that tongue is having rich blood supply. Okay, because see, whatever we are discussing in the gross, okay, in applied you can see that is nothing but the application of the gross structure whatever we have studied. Okay, for example, in the applied anatomy of the tongue, if you see, first applied importance is related to the blood supply of the tongue. Okay, I hope you have heard about angina pectoris. Yes, you have heard about angina pectoris. Okay, so whenever a person is having angina pectoris, at that time what is done? Sorbitrate tablet is given sublingually. What is the meaning of sublingual route? What is the meaning of sublingual route? That means you will ask the patient to elevate the tongue and you will put the tablet below the tongue. Okay, you will not ask the patient to swallow it. ठीक है, ऐसे करके patient will elevate the tongue and you will put the tablet just below the tongue. Okay, so that is sublingual route. Whenever we are taking any drugs, there are different routes of administration. Okay, for example, oral route, sublingual route, intravenous route, intramuscular route. Okay, like these different routes are there. Oh, hello, not allowed. Go to library. So these are different routes of the administration of drugs, right? So among them, one route of administration is sublingual. Sublingual का मतलब क्या है? Below the tongue. So you have to elevate the tongue. You have to put the tablet below the tongue. Sorbitrate. Okay. So it is a life-saving drug. Okay, and when during the time of angina, when the spasm is taking place of the blood vessel, it got relaxed by this particular sorbitrate tablet. Okay, it is a very potent vasodilator. Okay, so now the question is why the person will not swallow the tablet? Why you have to put sublingually? Any idea? Just think. I will give an example. Suppose after any type of injury, when you are suffering from pain, you take painkiller. ठीक है, painkiller tablet जो होता है analgesic. Does it act promptly? Does it act instantly? No, it takes time to act. Okay, just imagine you had an injury, you are suffering from severe pain. Okay, you took an analgesic. Just after taking the analgesic, you will not get relief. Pain will be there. Gradually, the pain releases. Okay. Now, why it is taking place? Because when you are taking that particular pill or particular analgesic, when it will go, the absorption will take place. Okay. After that, metabolism will take place. Okay. Then it will go into the blood stream. That also from portal circulation. Okay. After that, venous circulation. Then it will reach the target organ. After that, it will bind with the receptor. Then it will start the function. Okay. So a long process is there. In the next year, means in second year, in pharmacology, in the primary part, you will be studying about pharmacokinetics and pharmacodynamics. Okay, in next year you have to study about pharmacology, right? So in pharmacology, you will be studying two important topics. In the beginning, pharmacokinetics and pharmacodynamics. At that time, you will study the movement of the drugs in the body whenever you are taking anything, how it is moving. Okay. Here what happens, whenever you are putting sorbitol tablet just below the tongue sublingually, okay, due to rich blood supply of the tongue, it will get absorbed directly in the blood. Okay. Once it is directly in the blood, it will go to the target organ. Okay. It will go to the effector site, bind to the receptor, and it will start functioning. That's why the patient is getting relief immediately. Okay. So that's why whenever you are giving sorbitol tablet, don't ask the patient to swallow it. Ask the patient to keep it just below the tongue. Okay. To get relief from the angina pectoris. Details you will study in pharmacology. So I hope it is clear about the importance of blood supply of the tongue. Okay. Next, Genoglossus. Okay, before going to the Genoglossus, can anyone tell me the extrinsic muscles of the tongue? Name of the extrinsic muscles of the tongue? Anyone writing anything inside the classroom, practical or notes, please stop it. If I see anyone writing, you have to leave the classroom. Okay, if you don't feel like attending the class, you can go, I don't mind. But don't do all those things inside the classroom. Okay, so last class we have discussed about the muscles of the tongue. So how many types of muscles are there? Two types of muscle, intrinsic muscle and extrinsic muscle, right? So 4 intrinsic and 4 extrinsic muscle. Okay, now do you remember the names of 4 extrinsic muscles? Yes, Genoglossus, very good. Okay, so like this 4 extrinsic muscles are there. Now which muscle is this? Genoglossus, extrinsic or intrinsic? Which muscle is the Genoglossus? Extrinsic muscle. Okay, so Genoglossus is called as safety muscle of the tongue. So that day I have shown you the origin insertion of the extrinsic muscles. So Genoglossus muscle is called as safety muscle of the tongue. Why it is called safety muscle of the tongue? Any idea? Because if Genoglossus get paralyzed, the tongue will fall back on the oropharynx and it will block the air passage. Okay, if Genoglossus muscle is paralyzed, then tongue will fall back into the oropharynx and it will block the air passage. That's why while giving general anesthesia, what is done? During anesthesia, the tongue is pulled forward to clear the air passage. Okay, because once general anesthesia is given, all the muscles, especially skeletal muscles, they are not acting. Okay, so at that time the tongue may fall back and block the air passage. That's why you can see the tongue is pulled forward to clear the air passage. Okay. Next, Genoglossus is a muscle which is used to test the integrity of the hypoglossal nerve. Okay, as we have studied that most of the muscles of the tongue are supplied by which nerve? Hypoglossal nerve, that is 12th cranial nerve. Now how you will check the integrity of the hypoglossal nerve? With the help of the Genoglossus. Okay, as you can see, Genoglossus is only the muscle which protrudes the tongue forward. Means it will help you to do the protraction of the tongue. Means you can take out the tongue from the oral cavity. That is the protraction of the tongue, and that is done by the genoglossus. Okay. Now, as I said, it is used for testing the integrity of the hypoglossal nerve. Okay. Now, if the hypoglossal nerve of the right side is damaged, at that time what will happen? The protrusion of the tongue will deviate to the right side. मान लो राइट साइड का हाइपोग्लोसल नर्व पे डैमेज हुआ है, तो व्हेन यू आस्क द पेशेंट टू टेक आउट द टंग और टू प्रोट्रूड द टंग, एट दैट टाइम व्हाट विल हैपन? द टंग आफ्टर प्रोट्रूशन विल डेविएट टू द राइट साइड. जिस साइड में डैमेज हुआ है उसी साइड में डेविएट होगा. ओके, that is the proof that the nerve is damaged, okay, or some problem is there with the hypoglossal nerve. So to check the integrity of the hypoglossal nerve, which muscle is used? Genoglossus muscle is used. Okay. So what happens? In this case, normal left genoglossus will pull the base to the left side. So normal genoglossus of the left side, it is normal. So it will pull the base on the left side, and apex will get pushed into the right side. Okay. So that is how you can determine that the hypoglossal nerve is paralyzed or hypoglossal nerve is injured. Can you see the paralysis? Okay, so in this diagram, the effect of the paralysis of 12th cranial nerve can be seen. Now, in this diagram, you can see base is pulled by the normal genoglossus, okay, to the left side, and tip of the tongue is deviated to the paralyzed side. Okay, and that can be seen once you ask the patient to protrude the tongue. During the protraction of the tongue will deviate to the affected side. Means जिस side का nerve affect हुआ है उसी side में tongue deviate होगा. Okay, so like this we can see the integrity of hypoglossal nerve. Okay, very important. Now, carcinoma of the tongue is quite common. Okay, especially in case of India, carcinoma of the tongue is very common. Okay, can you tell me why it is common? Because of chewing tobacco, pan masala and all those things. Okay, it is very common. Now, the affected side of the tongue can be removed surgically. Okay, when the carcinoma occurs, the affected part of the tongue can be removed surgically. But this is not the only solution. Along with that, what should be done? The cervical lymph nodes should be removed, or else what will happen? Any idea? If cervical lymph nodes are not removed, then what will happen? It will spread, okay, into different areas. Two types of spread are there. One is spread will take place in the near object, or you can say in the near structures. Another one is distant spread, where it will go and it can spread into various parts. For example, lung, it can spread even into the bones also. That is the distant spread. Okay, and nearby structure it can invade, for example, oral mucosa, in the lip, upper lip, lower lip. Okay, so these are the areas, sublingual area. These are the areas where the invasion can take place. Okay, so that's why after surgical removal of that particular part, what is done? The cervical lymph nodes are removed. Okay, for that block dissection is required. So you can see cervical lymph nodes are removed. That is, block dissection of the neck is required. Okay. Now, carcinoma of the posterior 1/3 of the tongue is very dangerous. Why? Because from posterior 1/3, as we have discussed in the lymphatic drainage, bilateral drainage is taking place. Okay, जो posterior 1/3 of the tongue है, वहाँ का जो lymphatic drainage है, it is taking place bilaterally. That's why if the carcinoma is taking place on the posterior 1/3 of the tongue, then it is more dangerous as compared to the anterior 1/3 because of the bilateral drainage of the lymph. Okay. So these are the question, conceptual question which can be asked, okay, during the time of exam. That's why lymphatic drainage of the tongue is important. Okay. Next, tongue tie. I hope you have heard about this tongue tie. क्या होता है? Do you remember the frenulum of the tongue? Okay. Now I have shown you the attachment of the frenulum of the tongue. Okay. Now if the frenulum extends too far towards the tip of the tongue, at that time that condition is called as tongue tie. तो उसमें क्या होगा? The movements of the tongue will get affected, and that will also affect the speech. Okay. A person having tongue tie will not be able to speak properly. So it can be corrected surgically, and the name of the procedure is called as frenectomy. Okay, the procedure is called as frenectomy. Next, I hope you have heard about referred pain. Have you heard about referred pain? Yes. Everyone, I hope you are aware of the referred pain. Yes. Now, what do you think when there is carcinoma in the tongue? Can there be any referred pain? See, for that, what we have to understand? You have to understand about the nerve supply of the tongue. For carcinoma of the tongue, which part should be understood? Lymphatic drainage. For referred pain, what you have to understand? Nerve supply of the tongue. Okay, so whatever we have discussed earlier, it is correlated, right? So, referred pain of tongue, where the person will feel the pain, which are the areas will be affected. Okay, that you have to understand. So, the patient with cancer of the tongue often complains pain in the ear, TM joint, temporal fossa or lower teeth. That means these are the areas which are affected. Okay, or the pain can be felt in that particular area if carcinoma is there in the tongue. Okay, so that is referred pain of cancer of the tongue. Now, why it is taking place? Frequently, the referred from the branch of mandibular nerve. Okay, for example, carcinoma commonly involves the anterior two-third of the tongue. Okay, if the carcinoma is there on the anterior two-third of the tongue, at that time what will happen? It will be carried by the lingual nerve, and the pain will refer through the division, or you can say through the distribution of which nerves? Auriculotemporal nerve, inferior alveolar nerve. Okay, and patient will feel pain in the ear, external ear, temporomandibular joint, temporal fossa and lower teeth. Now, why have you understood the connection? Anterior two-third of the tongue, which nerve is mainly supplying the anterior two-third of the tongue? Lingual nerve. Lingual nerve is a branch of mandibular division of the trigeminal nerve. Okay, this auriculotemporal nerve and inferior alveolar nerve, they are also the branches of mandibular nerve. Okay, so that's why if that particular part is affected, then referred pain will be felt in the areas which are distributed by these two nerves. Okay, so that is the referred pain of the tongue when cancer is present, especially in the anterior two-third of the tongue. Okay, so for that, as I said, the concept of the nerve supply should be clear, then only you can understand. That's why in the beginning I have asked you whether you know the concept of referred pain or not. Okay, if you know the concept of referred pain, you will understand, but for that you have to know the nerve supply of the tongue. Okay, so that's all about the applied importance. Other applied importance are also there. Okay, but I have selected the important and few. Okay, apart from this, if anything is there, please study from your own. Okay, and after that, if there are any doubt, you can come and ask. Okay, so tongue is over. Next, I'll start from a important topic, that is palate. Okay, now when you are studying the skull, at that time, have you seen the hard palate? Anyone? While studying the skull, have you seen the palate? I know you have not studied, but at least when the skull is there with you, you can see the palate. How does it look like? Okay. Now, what exactly is the palate? The palate, the term refers to the roof. Okay, roof of the mouth. Palate का मतलब क्या है? It refers to the roof of the mouth. Okay. So previously we have discussed about the oral cavity. While discussing about the oral cavity, I have defined the boundaries of the oral cavity. Right. At that time I have mentioned about the palate. ठीक है, तो ये जो palate होता है, it forms the partition between the oral cavity and nasal cavity. Now in this particular section, can you see this is the nasal cavity and this is the oral cavity. So in between these two, the partition which is present, it is called as palate. Okay, is it clear? Now as I said, palate is forming the partition between the nasal cavity and the oral cavity. Next, palate is having divided into two parts. Okay, as you can see, palate is divided into two parts, hard palate and soft palate. Now the skull which you are having, in that the palate which you see, that is the hard palate. Soft palate you can't see because it is made up of soft tissue. So soft tissue is not present in the skeleton, whatever you are having. Okay, that's why you can't see the soft palate. But hard palate you can see. Why you can see? Because it is completely made up of bone. Okay, so most of the palate is made up of hard palate. Okay, that is bone. You can see anterior 4/5 of the palate is made up of hard palate, and posterior 1/5 is made up of soft palate. Now in the diagram, can you see the hard palate? So see, this entire part is the hard palate, and this small part is the soft palate. Okay. So we will not discuss in detail about the hard palate because that you will be studying in osteo. Okay, just a brief introduction about the hard palate, and then we will go and discuss about the soft palate. Okay, very important structure. Okay, why soft palate is important? Whenever we are swallowing something, at that time soft palate plays a very important role. After that, whenever you are sneezing, the blast of the air which comes out, okay, at that time this soft palate only, it will distribute the blast of the air into the oral cavity and nasal cavity. Okay, so like this, some important functions are there of the soft palate. That's why we will be discussing more about the soft palate. Okay. So hard palate, as I said, it is a partition between the oral cavity and the nasal cavity. Okay. Now anterior 2/3 of the hard palate is, let me show the diagram. So I hope you have seen this particular part when you have studied the skeleton, especially at the norma basalis. You can see this particular part. Okay. So hard palate, as I said, it is a partition between the nasal cavity and oral cavity. Now how it is formed? It is formed by which bones? It is formed by palatine process of the maxilla. As you can see, these are the palatine processes of the maxilla, and these are the horizontal plates of the palatine bone. Okay, this is how the hard palate is formed. Okay, first ऊपर में क्या रहता है? Which bones are there? As you can see, palatine processes of the maxilla. Here also on both the side. Okay, and here you are getting the horizontal plates of palatine bone. Okay, this is how the hard palate is formed. In between that, can you see the sutures present? Okay, so this is the intermaxillary suture, and here you can see palato-maxillary suture. So in the skull bone, sutures are present. Already you know what are sutures, what are different types of sutures. Okay. Now, if you see anterolaterally, okay, which part is anterior and which part is posterior? ऊपर वाला क्या है? Anterior. So this is the anterior aspect, this is the posterior aspect. Okay. So anterolaterally it is continuing with what? It is become continuous with the alveolar arches and the gum. As you can see, this is the alveolar arch and the gum. It is continuing with alveolar arches and the gum. Now posteriorly, what is present? Posteriorly the soft palate is attached to the hard palate. Posterior margin जो होता है hard palate का, okay, उसमें क्या attached रहता है? Soft palate is attached to the posterior margin of the hard palate. Okay, so this is the posterior margin. Here you will be getting the attachment of the soft palate. Okay. Next, in the hard palate, you can see different foramina are there. Okay, for example, here you can see incisive fossa is there. Then these are the greater palatine foramina. These are the lesser palatine foramina. Okay. Now through these foramina, various structures are passing. They will come and they will supply mainly the oral cavity. Okay. So all the foramina, whatever it is present, okay, that will be discussed in the osteology class. Next, when you open the mouth, okay, at that time the roof of the oral cavity, which is formed by the hard palate, in that, okay, the bone is there and it is covered by a mucosa that is called as masticatory mucosa. Okay, I am talking about this part. I hope you have understood. Okay, that is made up of hard palate. Now directly bone is not there. It is covered by a mucosal layer, and that is called as masticatory mucosa. Okay. Now, what are the features present? So, I am talking about this particular part. Whenever you are opening your mouth, Okay, stand in front of a mirror, just open your mouth, stand in front of a mirror and see the roof of the oral cavity. I hope you can see all those things, right? These structures can be seen. So as I said, it is covered by a mucosa that is called as masticatory mucosa. तो उसमें क्या क्या रहता है? So anterior part of the masticatory mucosa is firmly attached to the bone of the hard palate. Okay, or you can say periosteum of the hard palate with sharpish fiber, so that whenever you are chewing and then whenever you are swallowing, that food bolus will not take away the mucus or will not displace the mucous membrane. ओके तो ये देखो, ये बोन है हार्ड पैलेट. ओके, तो हार्ड पैलेट is covered by a masticatory mucosa. Now this masticatory mucosa is attached to the periosteum of the hard palate by sharpish fiber. Why it is important? Or else whenever you are swallowing something, the food bolus will do friction, will have friction, and because of the friction this masticatory mucosa can get damaged. That's why these sharpish fibers are there. Okay. Next you can see two important features are seen. Can you see some transverse ridges going from midline laterally? Can you see the transverse ridges in the diagram? Here, ye dekho, these are the transverse ridges. Okay, so these are called as palatine rugae or also called as transverse masticatory ridges. Transverse masticatory ridges or also called as palatine rugae. Okay, that can be seen. Okay, you also can see once you open your oral cavity, stand in front of mirror, you can see this one. Transverse ridges are present. Okay, so these are irregular asymmetric ridges of connective tissue. Next, in the midline you can see a palatine raphe is present. Okay, so see, this is the midline palatine raphe. Okay, from the incisive papilla it is extending and then going posterior. So these are some important characteristic features which you can see in the masticatory mucosa of the hard palate. Okay. Next, what are the functions of the hard palate? Hard palate का function क्या है? First of all, hard palate plays a very important role in both feeding as well as in speech. Okay. In feeding means during suckling the hard palate will create the vacuum which will force the liquid to go into the oral cavity. Okay, so that is one important function. Second important function, along with the tongue, the hard palate is essential for creating certain phonetic sounds. Okay, now I don't know whether you have seen or not, if any person is having cleft palate. Okay, if any person is having cleft palate, at that time what happens? That person, whenever he or she is speaking something, okay, the words which are coming out, it's very difficult to understand. I hope you have noted that. Okay, so that indicates this hard palate is very important for production of speech, production of certain sounds. Okay, so these are the functions of hard palate. Okay. Next, we'll start with the soft palate. Okay, so I hope you have seen the location of the soft palate. कहाँ पे रहता है? The posterior margin of the hard palate is giving attachment to the soft palate. ठीक है? And most of the roof of the oral cavity is made up of hard palate. Small part is made up of soft palate. Okay? Now, soft palate is made up of what? जो soft palate होता है, it is made up of what? As you can see, it is made up of fibro-musculo-glandular curtain. That means fibrous tissue are there, muscular tissue, that means muscles are present, and glandular means mucus secreting glands are also present in the soft palate. Okay, and it is just like a curtain, okay, which is hanging from the posterior margin of the hard palate. Okay, now if you see the anterior part of the soft palate, it is fibrous in nature, middle part is muscular in nature, that means muscles are coming and attaching into this particular part, and the posterior part is glandular in nature, that means mucus secreting glands are present. Okay, and in soft palate some taste buds are also there. Okay, जो soft palate होता है उसमें taste buds भी रहता है, and those taste buds are very active in case of children. Okay, so some amount of taste buds are also present in the soft palate. Now, anyone, do you remember? I have given one. I have given one example while explaining about the histology of tongue. During histology of tongue, we have discussed about the taste buds of the tongue, structure of taste bud. At that time, I have given one example. Do you remember? Means after vomiting, once you rinse your mouth, still you can feel the taste. Okay, because nothing is there in your oral cavity, but still you are getting the taste of that vomitus. क्यों होता है? Because when you vomited, those vomitous particles they got attached to the soft palate also. Okay, and that soft palate they are having some amount of taste bud. So when you are rinsing your mouth, you are cleaning the oral cavity. You can't clean the soft palate. Okay, and after some time, the taste disappears. Okay, so that is the proof that soft palate is also having taste buds. Okay, but those taste buds are very active in case of small children. Now the movements of the soft palate. So soft palate, though it is made up of smooth tissue, okay, that's soft tissue. That's why movements of the soft palate are taking place. Okay. Now for the movements of the soft palate, as I said, the muscles are attached to the soft palate. Okay. Now the question is, what is the importance of that movement? Because of the movement, it helps in deglutition, production of the speech, blowing of air through the mouth. Okay, closing the pharyngeal isthmus. So these are some important functions of the soft palate for production of the speech, and then during the time of deglutition, whenever you are swallowing something, okay, at that time the movement of the soft palate is very important. Now soft doesn't have any bony skeleton, means bones are not present in the soft palate. Okay, though bones are not present in the soft palate, then the strength of the soft palate is given by the aponeurosis. Okay, and that is called as palatine aponeurosis. So here you can see the palatine aponeurosis is giving, or you can say it is strengthening the soft palate. Now this palatine aponeurosis is attaches to the posterior edge of the hard palate. Okay, and the posterior, if you see the aponeurosis, it is thick anteriorly and thin posteriorly. Now here you can see the soft palate. Okay, see in this section also you can see the soft palate, and in this section also you can see the soft palate. Okay, so it is just hanging like a curtain from the posterior margin of the hard palate. Okay, it is having fibrous tissue, it is having muscular tissue, and it is having glandular element also. These are the three things. And though it is not having any bones in it, so how it is strengthened? It is strengthened by the palatine aponeurosis. Okay. Next, if you see the external features of the soft palate, okay. So what you have to know? First of all, you have to know the shape of the soft palate. So when it is relaxed, it is not doing any function. At that time, it is quadrilateral shaped. It is quadrilateral shaped. Okay. Next, in external features, how many surfaces, how many borders are there? So 2 surfaces and 2 borders are there. Okay. So as you can see, it is quadrilateral in shape when it is not contracting, not doing any function, and it is having 2 surfaces and 2 borders. So what are those 2 surfaces? Anterior surface and posterior surface, superior border and inferior border. Now you have to understand the surfaces. So if you see the anterior surface, first of all, it is oral surface and it is concave. Okay. Next, in the oral surface, the median raphe is present. Next, if you see the posterior surface, it is continuous with the floor of the nasal cavity, the posterior surface. Okay, the posterior surface is convex and it is continuous with the floor of the nasal cavity. Superior border is attached to the posterior border of the hard palate, and inferior border is free. Okay, and it is forming the anterior boundary of palatopharyngeal isthmus. Now let me show you the diagram. Now in this diagram, can you see the soft palate? So see, this is the soft palate. Okay, so soft palate ka, this will be the anterior surface. This is the anterior surface. This will be the posterior surface. Okay, as I said, anterior surface is concave. Please focus over here. ये देखो, this is the soft palate. This is the soft palate which is hanging from the posterior margin of the hard palate. Now this is the anterior surface and this is the posterior surface. The anterior surface is concave, posterior surface is convex. Okay. Now posterior surface is continuing with the floor of the nasal cavity. So I hope it is clear, the anterior surface, posterior surface. Okay. How many borders are there? Two borders are there, superior border and inferior border. तो जो superior border है, okay, that is attached to the posterior border of the posterior margin of the hard palate. And इसका जो inferior border है, the inferior border is free, and that inferior border is forming anterior boundary of the oropharyngeal isthmus. Okay, this is the oropharyngeal isthmus. This one, this particular part. Okay. Next, in the diagram, yeah, in this diagram, can you see the uvula? Uvula part. This is. Can you see the uvula? Have you heard about it? Anyone? Uvula? क्या होता है? And where it is attached? So this is a part of soft palate. This uvula, this is a part of soft palate. So it is a conical, very small tongue-like projection, okay, hanging downwards from the middle of the soft palate. Okay, conical, small tongue-like projection hanging down from the middle of the soft palate. That is called as uvula. Okay. Now uvula is mainly made up of muscles of the soft palate. Okay. Insertion of the muscles of the uvula, which is covered by mucous membrane. This is how the uvula is formed. Now this uvula is having important function in the closing of palatopharyngeal part during the time of deglutition. So palatopharyngeal part is closed during the time of deglutition, and this uvula helps during the time of closure of the palatopharyngeal part. Okay. So here you can see a tongue-like projections which is hanging, okay, from the middle of the soft palate. Okay, it is made up of muscles of the uvulae, mainly the musculus uvulae, and which is covered by mucous membrane. Okay. Next, from the each side of the uvula, so uvula medianly रहता है, it is present in the midline. From the uvula, two lateral folds, or you can say two folds of mucous membrane extending downwards and laterally. I hope you can see. So this is the uvula. Okay, you can see these folds of the mucous membrane which is extending laterally downwards. Okay, so first is the palatoglossal arch, and then is the palatopharyngeal arch. Two folds of mucous membrane extending downwards. One is presenting anteriorly, another one is present posteriorly. The anterior arch is called as palatoglossal arch. Posterior arch is called as palatopharyngeal arch. Okay. तो palatoglossal, glossal का मतलब क्या है? Tongue. Glossal मतलब tongue. Anywhere if you heard the terminology glossus or glossal, इसका मतलब क्या है? It is related to tongue. Okay. Now here you can see first of all palatoglossal arch. Okay. So from the uvula it is extending to the tongue. Now which part of the tongue? The junction between the anterior 2/3 and posterior 1/3 of the tongue. So this is a fold of mucous membrane which is extending. Inside that particular fold, what is present? Palatoglossus muscle is present. Do you remember the palatoglossus muscle? We have studied about the extrinsic muscles of the tongue. In the list, palatoglossus muscle was there. Okay, so I am talking about that palatoglossus muscle. Okay. Next, another fold is there which is situated posteriorly, that is palatopharyngeal arch. इसमें क्या रहता है? Palatopharyngeus muscle is present. Okay. So as I have shown you in the diagram, so two folds are there, two confolds of the mucous membrane extend downwards and laterally. Anterior fold is called as palatoglossal fold, which contains the palatoglossus muscle, and posterior fold is called as palatopharyngeal fold, which contains the palatopharyngeus muscle, and this palatopharyngeus muscle is also forming the posterior boundary of the tonsillar fossa. Okay. Now, so if you take the soft palate, okay, if you take the soft palate, you have taken a LS of the soft palate, not TS. Soft palate, you have taken the LS of the soft palate, and if you see what are the layers, you can see after taking a LS of the soft palate, what are the layers that can be seen. Okay, so here you can see these are the layers which can be seen. So two different types of mucous membrane are there. Okay, or you can say two different types of lining epithelium will be there. Okay, why two different types of lining epithelium? Because in the beginning I have told you the posterior border is the continuation of the floor of the nasal cavity. Okay, so that's why the lining epithelium in that particular part will be different. Okay, so just see the diagram to see this is the pharyngeal surface of the soft palate. Okay, this is the pharyngeal surface, and this is the oral surface of the soft palate. So in pharyngeal surface and oral surface, the lining epithelium will be different. Okay, can you differentiate the lining epithelium? Dono side ka? This is the oral surface. This is the oral surface, and this is the pharyngeal surface. So here the lining epithelium is different. Here the lining epithelium is different. Okay. Now in the pharyngeal surface, can anyone tell me which will be the lining epithelium? It is respiratory epithelium. So which epithelium is the respiratory epithelium? Respiratory system histology is done. It is pseudostratified ciliated columnar epithelium. Okay, that is the respiratory epithelium. So respiratory epithelium is present on this particular surface, pharyngeal surface. Okay. Next, if you see the oral surface, what will be the lining epithelium? Stratified squamous non-keratinized epithelium. Okay. Oral surface. See, here we have studied the tongue also. At that time I have mentioned in oral surface, oral mucosa, कौन सा epithelium रहता है? Stratified squamous non-keratinized epithelium. Okay, so that is present over here. Okay. Next, in between that, other structures are also present. For example, next to this layer, the palatine glands are present. Okay, layers of palatine gland. Then you can see these are the muscles. Okay, different muscles are present. Extrinsic, intrinsic muscles are also present in the soft palate. Then palatine aponeurosis, which is not shown over here, but palatine aponeurosis is also there. Okay, and after that palatoglossus muscle, and then again we are getting a layers of palatine glands. Then you can see the blood vessels also. Okay, and then mucous membrane of the buccal surface. So these are the layers which are present in the soft palate. So in soft palate, the fold of mucous membrane enclosing 5 pairs of muscles. Okay. Now the nasal surface is lined by which epithelium? As you can see, pseudostratified ciliated columnar epithelium. Okay, and the oral surface is lined by non-keratinized stratified squamous epithelium, which I have shown you just now. Okay. Next, in the submucosa, mucus secreting glands are present. Okay, in submucosa, mucus secreting glands are present. Okay, and then some taste buds are also there. Okay, you can see the oral surface of the soft palate contains some taste buds, and along with that, lymphoid tissue are also present. Okay, so these are some important features of the soft palate. When you will take a LS of the soft palate, at that time all those structures can be seen. Now here in this particular diagram, you can see these are the palatine glands. Okay, here you can see these are the palatine glands. Next, here you can see this is the uvula, and here you can see these are the different arches. This is the palatoglossal arch, and this is the palatopharyngeal arch. Okay. Next, I have mentioned about the palatine aponeurosis, which is strengthening the soft palate. Okay, so here you can see this is the palatine aponeurosis. Okay, if this entire part, this is the palatine aponeurosis. Okay. Along with that, you can see some blood vessels and nerves also, which are supplying most of the soft palate and hard palate. Okay. Next, palatine aponeurosis. It is a fibrous structure of the soft palate. Now, how it is formed? It is mainly formed by the expansion of the tendon of a particular muscle, and that is tensor villi palatini muscle. Okay, इसका जो tendon है उसका expansion होता है, then it is formed. Now it is attached in front to the posterior margin, okay, of the hard palate, and on the either side it is continuing the aponeurosis. Okay. Now in the midline it is splitting and it is enclosing the musculus uvuli. Okay, that is how the palatine aponeurosis is present in the soft palate. Here you can see the diagram. This particular part is showing the aponeurosis of the soft palate. Okay. Now along with the aponeurosis of the soft palate, you can see the muscles of the soft palate also. Okay. For understanding the muscles of the soft palate, I will request everyone to see this particular diagram, this one. So how many muscles are there attached to the soft palate? 5 pairs of muscles. Okay. 5 pairs of muscles are there attached to the soft palate. 5 pairs का मतलब क्या है? 5 on this side, 5 on that side. Okay, दोनों side में 5 total 10 muscles are there. Next, among them 4 are extrinsic muscles. Okay, out of 5, 4 are extrinsic muscle and 1 is intrinsic muscle. Okay, can you show me the intrinsic muscle over here in this diagram? Can you see the intrinsic muscle? See, this one is the intrinsic muscle, musculus uvuli. So this musculus uvuli, this is the only intrinsic muscle present in the soft palate. Rest all the muscles are extrinsic muscles. Okay. So same like the muscles of the tongue, extrinsic muscles of the tongue, you have to know the origin and insertion. So with the help of this particular diagram, we will try to understand the origin and insertion of the muscles. First of all, can you please name the list of the muscles? See, it's given over here. Tensor villi palatini, levator villi palatini. Okay. Then here you can see palatopharyngeus and palatoglossus. So these are extrinsic muscle and only one intrinsic muscle, that is the musculus uvuli. Okay. So these are the list of muscles present in the soft palate. Okay. Now you have to know the origin, insertion, because based on that we have to understand the function of the soft palate. Okay. So first is the tensor villi palatini. Here you can see the tensor villi palatini muscle. This is the tensor villi palatini muscle. Okay. So from where it is coming? Mainly it is coming from the sphenoid. Okay. There is a part called scaphoid fossa and medial pterygoid plate of the sphenoid. Though you have not studied the sphenoid bone, that's why as a whole I am taking the sphenoid. Okay. So here you can see I am talking about this muscle, ye wala muscle. Okay. So here you can see the tensor villi palatini is arising from the sphenoid bone and it is also arising from the auditory tube, or also called as pharyngotympanic tube. Okay. And then where it is attached? It is attached to the palatine aponeurosis. Okay. So this is the tensor villi palatini. Next you can see the levator villi palatini. See, this is the levator villi palatini. So it is also arising from the auditory tube or pharyngotympanic tube, and along with that it arises from the temporal bone also, petrous part of the temporal bone. Ye dekho, petrous part of the temporal bone, and it is also attached to the palatine aponeurosis. Okay. So this is levator villi palatini and tensor villi palatini. Next, what are the muscles? Next muscles you can see palatopharyngeus. So this is the palatopharyngeus and this is the palatoglossus. Ye dekho, this is the palatoglossus and this is palatopharyngeus. Palatopharyngeus, you can see it is arising from the posterior margin of hard palate, and along with that it is also arising from the palatine aponeurosis. Now it is going downwards, palatopharyngeus, and then it will go and attach to the lateral wall of the pharynx. Palatopharyngeus means it is coming from the soft palate and then it is going towards the pharynx. Where to the pharynx? Lateral wall of the pharynx. Okay. Next, palatoglossus. The palatoglossus already we have discussed. Okay, from the aponeurosis of the soft palate, and then it is attaching to the side of the tongue. Okay, so these are the extrinsic muscles. Extrinsic muscles का मतलब क्या है? Origin or insertion is outside the soft palate. Now only one muscle is there which is intrinsic. Which one is that? Musculus uvuli. Okay, so see this particular muscle, this musculus uvuli. Okay, so musculus uvuli, posterior nasal spine and palatine aponeurosis. Posterior nasal spine and palatine aponeurosis. This is the origin. Okay, and mucosa of the uvula, in that particular part it is attached. So this is the only muscle which is intrinsic in nature. Okay, so these are the origin and insertion of muscles of the soft palate. Okay, now what do you think, what will be the function based on the origin and insertion? What do you think, what will be the function? First we will see the tensor villi palati. Okay, now here you can see the tensor villi palatini, this one, tensor villi palatini. So first of all it will tenses, it will create tension in the soft palate. Along with that it will open the pharyngotympanic tube. This is the pharyngotympanic tube. So it helps in opening of the pharyngotympanic tube during swallowing or during yawning. During yawning and during swallowing it helps in opening of the pharyngotympanic tube. Next is the levator villi palatini. Levator means what it will do? It will elevate. So it elevates the soft palate. Along with that it also helps in opening of the pharyngotympanic tube. Okay, mainly it elevates the soft palate during swallowing and yawing. Okay, next palatoglossus का function क्या है? Palatoglossus already we have studied during the time of tongue. Okay, see I am talking about this one, palatoglossus muscle. So mainly it will lift the tongue, so it helps in elevating the tongue. Okay, that is the palatoglossus. Next you can see the palatopharyngeus. Okay, so palatopharyngeus का function क्या है? Tenses the soft palate, pulls the walls of the pharynx anteriorly and medially. Okay, anteriorly, medially and superiorly, this is, it will pull the wall of the pharynx during swallowing. So that is the function of the palatopharyngeus muscle. Okay, and musculus uvuli, what is the function? It shortens the uvula and pulls the uvula superiorly. That is the function of the musculus uvuli. Okay, so these are the functions of the muscles of the soft palate. Okay, now here you can see this is the list where all the muscles are listed. Okay, all the muscles are listed. This is the attachment. Okay, superior attachment, inferior attachment. That means this is the origin, this is the insertion. Okay, this is the innervation. Now in case of innervation, all the muscles of the soft palate, okay, are supplied by pharyngeal branch of vagus via pharyngeal plexus. Okay, pharyngeal branch of the vagus via pharyngeal plexus. All the muscles except tensor villi palatini, which is supplied by nerve to medial pterygoid, which is a branch of mandibular nerve. That is the exception, and that exception we have seen in case of tongue also. Okay, and as I said, all the muscles are extrinsic except musculus uvuli, which is intrinsic in nature. Okay, so that is all about the muscles. Okay, next blood supply, nerve supply is left along with the applied, that will discuss in the next class. Thank you.